in whole European countries, except on the east, like Poland, Hungary, Czechia, and Slovakia, who we see very large increases, much higher. In fact, this is the first wave for those Eastern European countries. But for the Latin countries or UK also, we see that it is now spreading all over the countries. It is really the fact that now, during this season, and it's a question of seasonality, we have seen this very long course of the COVID disease in the South American countries. We see that now in the autumn, and during the whole winter we will see that in Europe as well, for the whole countries. And if we understand that, we don't have to use the same techniques and the same methods as the one we use in the spring, because again, and what mentioned Laura in Rome, is really the fact that we see now much younger median age for the cases, but cases are not sick people, that are just people who have encountered the virus and have them in their nose, and you can pick it up. It just means that they have it. They could be, they may have had the disease and recover. They may be just asymptomatic, and most of the young people are asymptomatic. So this is not the case. When you see the age, the median age, when you go to intensive care, this is the 65, 70. It is a little bit higher in France than it used to be in the spring. And the age, the median age at death is exactly the same. It's 84 in France, and I think in Switzerland and in Italy, it is roughly the same. You may perhaps give those numbers, but it is really showing that the most severe cases, the epidemiology didn't change on that. But the cases now are increasing exponentially because we are looking for them and because it is spreading very, very quickly. And we are 2,000 kilometers behind the virus.
Yeah, and one other big difference between now and the spring is the fact that back in spring there was a lot of debate, there's a lot of anger about the fact there wasn't enough PPE, that's protective equipment, there weren't masks, there were, even in some instances, it was difficult to get hold of sanitizing gel for your hands. None of that's the case here in France, at any rate, in the month of almost November, October, November now. So why can't we just live with the virus by wearing a mask and wearing and using hand sanitizer and maintaining social distancing? Let me ask you in Rouen, Jan-Cédric Hansen, what's the argument as to why we can't just carry on with our lives but wear masks and sanitize our hands as often as possible?
If we were cautious about doing it properly and constantly, it would be possible. But my experience as a geriatrician and working within home cares, where I have lots of friends and relatives of patients who say, trust us, we can apply the rules. And when we watch them meeting their relatives that are old and frailty people, they do not respect the rules. They just break the rules as soon as they can, because it is so emotive and so important for them to actually hug their relatives and their beloved one. And it's so difficult to fight against that very deep feeling. What happens is that you've got lots of clusters within home cares, especially in France, but it's true all over Europe. And it is so difficult to respect the rules. So if you see what happens between healthcare professionals and the patients, you see that the barrier is quite strong, and there is very little proofs of contamination between those who are cared of and those who are caring of. But when you come home, when you meet your friends or home, then you do not respect the rules so strictly, and then you get contaminated, as it was said by one of our guests tonight. And again, the issue here is: are we strong enough? Are we well educated enough to respect those barriers everywhere, anytime? If we do, then lockdown would be available. But since we didn't do it, obviously we will need the lockdown to dampen the spread of the disease. It will not treat it. And I would like to add a very critical point. What we advertise and at the Global Health Security Alliance is that the key factor of a disaster is not the disease itself, it is the effect of the disease on the population, on the economy, on the politics, and all the aspects of the society. And what we see here is that every culture is reacting differently, and in Europe, every country has its own dynamic of the disease, although it is at the global level quite homogeneous.
Okay, I can see Professor Toussaint wanting to jump in at this point.
Yes, it's a very important point that you made because the question of the first rule and the major rules are there. The question of the barriers that we need to have, the question of the physical distances, there is no discussion on that. It works and we have to keep that. But the second and the major rule for that is also the consent. And in the cares and the maisons de retraite, as we say in France, in the home cares, and it is one of the major and one of the most deleterious effects that we have encountered this summer with people that couldn't have their family around them because we were expecting the second wave or the first one in the Brittany cities, for example, when it never happened. And all this emotional side, and that was mentioned by Professor Jaffé, is also one of the major problems that was not dealt within the lockdown measures. So it is very important to have all these elements together so you provide the information to the people and then they can decide what they want to do of their life, especially when they are 92 years old and they want to have their children and their grandchildren with them for the major and the most important moments of their lives.